This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses or simply click on the link in our show notes and create an account.
Okay, so I'm doing a medical minute, so it's going to be about opioids. Yay! We're all so excited. So in case you don't know, the opioid epidemic is growing a lot worse with the COVID epidemic. We've already surpassed, back in September, our overdose numbers for Colorado, which were record highs last year, and it's predicted that we'll probably lose 30 to 40% more people with COVID. I think all of you have noticed that use disorders are just through the roof. As people have lost their jobs, as they're more isolated, as they're more stressed, people are drinking more, they're using more marijuana, they're using more street drugs. So it's more incumbent on us to know how to better treat people. Now, I'm going to talk about some very common side effects to opioids that we treat incorrectly, right? So opioids have a side effect profile of how many percent? How many percentage of people you give an opioid and they actually have an adverse event to it? Adverse reaction. It's actually around 50 to 80%, okay? Depending on the study. So you have a number needed to harm of 1 in 2. Now, most of those are benign, like I feel dizzy, or I feel nauseous, or I feel itchy, right? Or, hey, I can't poop and I haven't pooped for a week, right? So besides kind of those very common side effects, the other bigger things are overdose, addiction, all those other bad side effects. But I want to talk about the common ones because you treat them incorrectly so often. So when people get an opioid and they feel nauseous and start vomiting, what's the correct agent to treat them with? Zofran. Zofran's actually wrong, right? So not an alcohol pad. So there's two things. In the chemoreceptors of the brain that induce nausea and vomiting, there's two big neurotransmitters that cause nausea and vomiting. One is serotonergic, right? So serotonin, and the other is dopaminergic. So when you give an opioid and they have this huge dopamine surge, sometimes that also happens in the dopaminergic part of the brain, nausea vomiting centers. So the correct thing to treat them with is an antidopaminergic agent. So something like Reglan or Haldol or Zyprexa is a lot more effective than Zofran for nausea and vomiting induced by an opioid. Okay. So another thing that people often get is itching, right? So they feel itchy all over. What's the treatment for that? Atarax, Benadryl. So it's actually not histamine mediated. So besides making them more sleepy, those actually do nothing to control itching from opioids. So if you want to just make the person sleepy, you can do that, but it actually isn't really effective for it. Interestingly enough, that actually might have a serotonergic component. So sometimes Zofran will work better for itching from opioids. So again, it's a little bit weird, but again, we don't treat it. These are things we're not good at treating. So if someone can't poop because they've been on their Percocet for a while, what's the correct agent for that?
Scare them.
What? Scare them. So a lot of people, who says stool softeners? So stool softeners actually don't do anything for constipation induced by opioids. You want to give them promotility agents. So Senna is the first one that you want to give them. You can throw in some Miralax, but really you want something to get the bowel to move. Okay? So again, these are very common side effects that we treat incorrectly that are very common with opioids. So just so you know exactly what they are and how to treat them more effectively. So if you do have to give an opioid, which should be, fingers crossed, rarely, and they do have a side effect, now you can treat it better. Okay?
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.